Hello everyone, my name is Princess Alinta. The objective of this presentation is to expose the underlying issues surrounding infant death in Louisiana and provide interventions that can improve maternal-child health. I would be presenting this topic from the standpoint of an epidemiologist. Let's start by defining the problem. In 2016, the March of Dimes released a premature birth report card, which looks at preterm birth rates. The state of Louisiana received a grade of F. With a report score of 12.3%, Louisiana ranks to be one of the highest states in infant mortality, revealing 8.4 deaths per 1,000 live births. Infant mortality can be influenced by several factors, such as low birth weight, birth defects, preterm delivery, maternal complications, and sudden infant death syndrome. 47% of fetal deaths are caused by conditions originating in the perinatal period. During this time, a mother can experience preterm birth, which automatically puts her baby at risk. Preterm labor is the major contributor to the low birth weight in Louisiana. Factors that can trigger a preterm birth include smoking, drinking, illicit drug use, emotional abuse, and environmental factors. That brings me to the next topic. Smoking is another major factor that can leave the fetus with less developed lungs. The CDC explains that smoking affects the placenta, causing abnormal bleeding. In 2011, 4% of expecting mothers in East Baton Rouge, Louisiana, smoked or used tobacco products during their pregnancy. Although 4% may seem like a small amount, this data only accounts for those within a specific region of Louisiana. It is obvious that socioeconomic status has an influence on infant mortality rates in Louisiana. However, a connection lies between infant mortality and the public health system. Using the social ecological model, we can see that the factors range from individual level to the policy level. We will first take a look at the individual level. The main focus here would be prenatal care. Ensuring that both mother and baby are healthy should be the #1 priority. Prenatal care followed by consistent maternal checkups can be a way for health providers to detect any complications early on. Factors that can hinder women at an individual level would be tobacco use, which seems to be a very popular behavior amongst women 18 to 44 years of age in Louisiana. Next, we are going to focus on the interpersonal level. The major issue here would be for the healthcare providers or family members to ensure that expecting mothers are attending all prenatal appointments. This ensures that any chronic health conditions are caught at an early, timely manner. On the other hand, women that lack support from family members can be put in very emotional situations, often leading to poor pregnancy outcomes. Moving on to the organizational level, you can see that more than half of the women that live in Louisiana and give birth in Louisiana depend on Medicaid. As an organization, Medicaid should ensure that women have access to health benefits needed in order to reduce the risk of preterm labor and maternal death. As for the 28% of women in Louisiana that lack insurance, there are many risk factors that follow this specific population of women due to the lack of sufficient care that they receive. At the community level, it is important for the community to raise awareness of preterm births through prenatal classes. Community clinics can provide doula services to women who may be at risk for preterm labor. Limited or no access to healthy foods can have various adverse outcomes, which hinders the pregnancy at the community level. In communities with high poverty rates, there is usually limited access to nutritional meals. At the policy level, the state created the Louisiana Birthing Outcome Initiative, which showed a 20% decrease of admissions into the neonatal intensive care unit. Creating a policy that limits physicians from inducing labors unless it is medically necessary can decrease infant mortality rate. A decrease in public health spending can affect maternal and child health. Grants such as the Title V block grants supports programs and activities for pregnant women, infants, children, and teens. With the discontinuation of this grant, there will be an increase in health disparities associated with maternal and child health. Next, we will take a look at evidence-based interventions that can help address some of these issues. First, we focus on cognitive behavior therapy, with the target goal being to ultimately stop the use of tobacco products by pregnant women. We will then explore the promotion of doula services in order to extend doula service to uninsured women or those covered by Medicaid. Finally, we will take a look at a nutritional log application which aims to increase prenatal nutrition and supplement intake. Cessation of tobacco use and exposure is an important intervention strategy during pregnancy. 25% of women between reproductive age in Louisiana use tobacco. Cognitive behavior therapy and education can be utilized by social workers or healthcare providers in order to provide expecting mothers with support during cessation. Creating a program where expecting mothers can develop a relationship with a doula throughout the pregnancy can provide a sense of support to mothers throughout the community. Implementation of doula services to women with low socioeconomic status or to those experiencing a stressful pregnancy can provide a surplus of benefits throughout a woman's prenatal care. Communities in Louisiana sometimes lack a wide range of healthy options for expecting mothers. Therefore, it is important to reassure women that eating healthy would only be beneficial for their baby. The utilization of a pregnancy log can help mothers keep track of nutritional intake and can ultimately assist them with making better, healthy choices. The success of this intervention will be based on the decrease in tobacco use during maternity. Because using tobacco has an effect on a baby's birth weight, there would be an expected decrease in low birth weights as well, ultimately reducing infant mortality rates. Seeing a decrease in costs for maternal services as well as an increase in rate of awareness to doula services can measure the level of success for this intervention. Finally, a decline in cesarean rates will also be an indication of a successful intervention. The success of this last intervention can be measured by evaluating a decrease in low birth weight and also an increase in gestational age. So how do we evaluate this data? It is important to partner with local hospitals and clinics in order to obtain patient information needed for each intervention. Another method would be the usage of evaluation surveys to obtain data and measure effectiveness. This can allow the data to display a cause and effect relationship between multiple variables, resulting in probable health disparities. In addition, surveys can provide data analysis using statistical software such as Stata. So what are some potential challenges or barriers? Program participation for the cognitive behavior therapy is voluntary. Therefore, offering some type of incentive after the attendance of each behavioral session can help increase retention rates. Low retention can interfere with data outcome. An important aspect to consider when encouraging the use of doula services would be a woman's overall birthing experience. Evaluating birthing outcomes such as the use of medication during labor, spontaneous vaginal births, emergency C-sections, and the baby's overall health can all help measure the success of doula services. Moving on to the nutritional app, an important aspect to consider would be the accessibility of the nutritional options throughout the community. Let's now take a look at the intervention in a logic model. If we implemented cognitive behavior therapy for those who are in need of it, as well as provided doula services to women throughout the community while encouraging healthy behavior, then you would expect to see individuals increase of awareness to risk factors. For activities, doula support can provide open communication and trust between caregivers, resulting in mothers wanting to provide a healthy environment for their baby. Hopefully, these activities could result in statistical outputs that can be used to measure future health disparities within the community. Overall, Outcomes lead to a decline in tobacco use during pregnancy, a decrease in low birth weights, and a decrease in chronic illnesses resulting from improper diets. From start to finish, these interventions will result in improved infant mortality rates and reproductive health throughout Louisiana. I hope you find this information very helpful and consider utilizing these interventions. Thank you for your time and your consideration.